In this talk, I would like to present the results of our recent pilot studies of transcutaneous boiling histotripsy in vivo in a pig model. Boiling histotripsy is a focused ultrasound method that delivers millisecond-long pulses, the sequences of pulses with low duty cycle to mechanically ablate tissue. And our group at the University of Washington develops this technology toward the clinical use to treat renal tumors. So boiling histotripsy mechanically fractionates tissue by inducing shock wave, which are super focused into the focal region and induce localized heating to 100 degrees C within millisecond within this small volume. Then a vapor bubble is generated, and interaction of the incoming shock waves with this vapor bubble results in fractionation of tissue into subcellular debris without a thermal effect. Boiling histotripsy treatments have been shown to be readily visualized by standard B-mode ultrasound imaging, which is beneficial for the clinical use. And it was shown that it is capable of sparing connective tissues, which is also a nice clinically beneficial effect. So the motivation of this work was based on our previous studies. And in these studies, we have shown that single boiling histotripsy lesions can be produced in exposed porcine liver, single lesions in vivo. And in the next studies, we worked with the clinical systems, and we showed that volumetric boiling histotripsy lesions can be produced in ex vivo bovine liver and kidney. So the goal of this study was to demonstrate the feasibility of in vivo volumetric, transcutaneous, and partially transcostal ablation of kidney tissue in a large animal model. And this is toward development of this method into clinical application. Our studies so far included 6 animals, 6 pigs, and 12 kidneys. The pigs were anesthetized and placed laterally on the table. A 1.5 12-element sector rate transducer was submerged in the water bath and connected to the abdomen. And boiling histotripsy was generated in a discrete foci, 1 to 1.5 millimeter apart in the lateral direction and 5 millimeter in the axial direction of the beam, to produce a volumetric lesion of about 1 centimeter size. And then this treatment, they were visualized in real time during boiling histotripsy sonications. And then the results were also visualized using ultrasound imaging. Then, after necropsy, the kidneys were collected for gross analysis, histological analysis, and ultrastructural analysis. So this is the parameters of the treatment. We used from 5 to 30 pulses per sonication point. We increased power and decreased the length of the pulses so that we can accelerate the treatment. And we combined it with the change of the pulse repetition rate to keep the duty cycle of 1%. During the treatment, you can see this white echogenic spot that shows the treatment size and caused by the bubbles induced by boiling histotripsy. And after sonications, this spot will be hyperechogenic due to the loss of tissue structure. So here is the result of one case after the treatment. You can see on the gross picture on the top, the photo of the lesion. The photo of the lesion is below, and the ultrasound image is on the top. And the size and the position of the lesion, they correlate very well in between these two images. And the histological analysis shows also the same size of the lesion with the sharp boundary in between treated and untreated volumes, with some small petechial hemorrhage around the lesion because we did not do motion tracking, so some damage was there, but not too much. And so this sharp boundary was found in the cortex. In medulla, there was some blood in the collecting ducts around the lesion, but with completely homogenized central part of the lesion. And in the collecting system, we never damaged the wall, and we never damaged the capsule of the kidney. So we found, as expected, the relative change in sensitivity of different parts of kidney to boiling histotripsy. The most sensitive was cortex, then medulla, then collecting system, and then capsule, which was never damaged for treatment protocol that we used. The results of electron microscopy showed that all intracellular structure was lost, so everything was destroyed, which was a good sign. And we did not see a significant adverse effect, so there was no gross evidence of prefocal heating. There was some small bruising on the side wall in only one pig, and there was some blood clots in the collecting system found after the treatment. So in conclusion, in this work, we have shown that ultrasound-guided, transcutaneous, and even partially transcostal. We did 2 cases with about 50% coverage of the rib cage. It's feasible in vivo kidneys in pigs. We did not track the motion, and still we obtained some boundaries between treated and untreated tissue. We can accelerate treatment by using high peak power and shorter pulses of 1 millisecond. And overall, these studies are ongoing, and we are looking forward to developing it toward the clinical use. Thank you.